vaping. What is the downside? What kind of lung damage are we starting to see from this?
I believe that we're beginning to see sort of the early phases of this epidemic, which is vaping. Vaping causes a lot of injury to the lungs in terms of inflammation and in affecting the integrity of the airway and making the lungs, potentially more leaky. But it also has a lot more broad-reaching implications, such as increasing the risk for infections. And down the road, which is what everybody wonders, is whether or not it would increase the risk for developing cancers. This is like the tobacco epidemic, for example, in females, in which they're starting to smoke with the Virginia's limbs in the 1960s. And then we didn't see the problems with emphysema and COPD and cancer, several decades later. So many of the more chronic problems take a very long time to happen. So we will not know that for quite some time. But the worry and the expectations is that these products can cause significant damage, including cancer down the road. And they increase the risk for developing asthma as well. That's sort of a well-known fact.
If you have this population of people who are vaping and they're starting to have this inflammation or this early damage, what kind of an impact will that have on COVID?
I think from what we can extrapolate from cigarette smoking, for example, we know that tobacco smoking is associated with a twofold increase, at least in adults, of developing severe COVID. And that's been shown in other studies. Like cigarettes, vaping has many products that cause injury and inflammation to the respiratory lining. And anything that, in a way, destroys the integrity of the lung will make it more likely for viruses or other infections to penetrate into the lung tissue and cause damage. But in particularly, one of the receptors, for example, that the virus uses to get into the lungs, which is the ACE2 receptor that you've probably been hearing a lot on the news, increases with smoking. And there is a possibility that inflammation also produced by vaping could also, lead to changes like that make you more susceptible to developing a severe infection.
I know that you and your colleagues around the country have been looking at this issue. Can you tell me just a little bit about that initial research?
This paper was conducted using a large cohort of children, a very well-established study that's called the Southern California Children's Health Study. For this particular study, over 2,000 kids were part of the analysis, and about 12% of them have been habitual or past users of vaping products. And what the study finds is that there's this strong association between using vaping products and having something that's called chronic bronchitis. Chronic bronchitis, it's a very simple term that it means that you produce cough and phlegm for at least 3 consecutive months. That's really all it means. It's a very non-specific term, and it can be associated with a number of chronic conditions. But the one thing that does imply is that when somebody has chronic bronchitis symptoms, it means that you have more inflammation in your airway lining. So, in fact, vaping, and particularly those that use more than 2 or 3 vaping, that have had 3 or more vaping episodes in the past month, were more likely to have bronchitis. Certainly, some of that in this particular paper was associated with also being exposed to secondhand tobacco in the home. But even after adjusting for all these potential confounders, the study found significant associations in adolescents, in kids that were in 11th and 12th grade.
Is this alarming to you as a pulmonologist to see these trends?
It is very alarming. And unfortunately, I think there's always the situation in which adolescents feel like they cannot be harmed. They have the young age advantage. But unfortunately, when the insult keeps happening, so for example, if someone is having chronic bronchitic symptoms, it's already the lung is sending an alarm symptom saying, I have inflammation. An inflammation, when it goes unabated, unchecked, if somebody continues to have that insult coming back again and again and again, just like smoking, that inflammation eventually turns to structural damage in the lung that at some point crosses to be irreversible. either in the airways or the lung tissue, and or sets the stage for something that down the road is going to lead to cancer. And so it's very alarming, and it's convincing young people like, listen, you don't want to be having serious regrets 10, 15, 20 years from now when you're going to be wanting to have a real full life at that time. And as a pulmonologist, that's always the juncture, right? Convincing people at a stage in which they feel that they're not vulnerable to any problems, but they are in fact. An important part of the study is that non-Hispanic, non-whites in the study, so minority groups, were more likely compared to whites to have these symptoms in association with vaping. And to me, that's concerning because there's actually quite a bit of study that the uptake of vaping has been much greater in the Latino community, for example. So, and it may not necessarily mean particularly that, kids that are Hispanic or Black are more susceptible as far as we know, but they have perhaps other exposures or other situations that make it more vulnerable. But I think that's something that's important to take on from the study as well.
As you have seen an uptick in the research that more Latinos are vaping or turning to these methods.
If you look at some of the epidemiology of vaping in youth across the country, one of the groups that has had the most rapid increase in uptake of vaping has been Latinos. So there's very well-known studies that are done by the CDC and other groups that show that Latinos are one of the fastest growing vaping groups in the US.
Searches on COVID-19 and vaping hit a peak in March, right when it was declared a pandemic. Does it surprise you that people are not searching as highly as they did at the beginning?
It's interesting to me that right before the COVID pandemic hit, we were having a pretty serious discussion and press overview about the vaping epidemic that is happening still in this country, but now it's completely overshadowed by a problem that's much broader and perhaps more serious in a public health scale. But that doesn't mean that the vaping situation has gone away. And I think we will learn a lot more as studies keep coming up about individuals' susceptibility risk factors such as vaping and how they play out in this pandemic. And we just don't know that yet. I wouldn't be surprised that secondary peaks start to happen. People continue to be worried about these issues.
Parents are searching more on the potential problems associated with vaping and COVID than addressing any of the ways to mitigate it. Your impressions on that?
My own personal view, Cindy, is that there hasn't been enough, from a public health message, there hasn't been enough clear, concise messaging about things we can modify to reduce the risk. I mean, I think you hear all the time about, washing your hands, social distancing, avoiding crowds. That in a way, those are effective measures of reducing exposure to the viruses. Once we have the virus, there are things that, have perhaps not been tested, but stand to logic that, are probably good. And even actually before you get sick, things that could potentially mitigate the development of more severe disease. It's like, should we tell people, this is an important time in which you need to adhere to your medication regimen. You need to seriously consider quitting smoking or vaping, because these are potentially things that could be associated with developing more severe disease. I mean, these are very safe, sound public health messages that I think should be echoed and resonated a lot stronger than I've heard perhaps so far.
And the social scientists doing a look at the data, it didn't seem to be a big concern, this topic of COVID and vaping and impact. Why do you think that is?
We've conducted a fair amount of focus groups doing our own vaping research here in Colorado. And one of the things that meeting with kids from high schools that to me comes across really clearly is there is a lack of perception of risk in the use of these products. I mean, I think clearly kids think, it's not really a big deal. It's just vapor water, which is a misconception. And so people don't think that this is like tobacco. This is not like tobacco not acceptable, vaping acceptable in terms of social justification and risk perception. But the reality is very different, right? I mean, these are very seriously bad products for you, especially when your lungs are developing, And in adolescence, the lungs are still, in many adolescents, especially during early adolescence, the lungs are still in full growth phase and development phase. we do not reach our peak lung growth capacity till we're kind of at the end of adolescence, early adulthood. So, you're affecting an organ at its peak of its development. And so the long-lasting effects could be pretty severe down somebody's life.
The vaping and the smoking industry seem to cast doubt on this link between vaping and COVID. What do you say to that?
Anytime you hear opinions from the vaping industry, which is largely supported and obviously and even purchased by tobacco companies, you have to understand that this is an incredibly conflicted message, because what they're really interested in is selling their products. So even though they may wrap it up in some quasi public health message, the reality is they want to sell, they want to make money and profit. At the way I see it, they want to make profit at the expense of our health and at the expense of the health of our children and those that are more vulnerable, which is terrible. Well, they're doing it in service, and you cannot dismiss, Cindy, the fact that there is very good data now, very good data that shows that this product causes pretty significant changes in the lung and pretty significant inflammation. The products that are generated when the glyceraldehyde and some of the glycerol products that make the liquid phase of the vaping, which is not water, which is what everybody thinks is not water. It's a vehicle, and the vehicle, when it hits, it forms secondary compounds that are called formaldehydes. And so these compounds, for example, are highly toxic and highly irritating to the lining of the airways. So to me, it's unquestionable. Then on top of that, you add thousands of different products that are used for flavoring and coloring, many of which have actually been linked to occupational health hazards. So as you know, the diacetyl, which is the one that causes the buttery flavor for popcorn, causes something that's called popcorn lung disease, which is a terrible occupational lung disease. And we are putting the same products in vaping issues that people are putting into their lungs. It just seems crazy to me. So you cannot, I think that the magnitude and the strength of the science of how these products cause damage is unquestionable, 100%. We don't know many of the long-term consequences, but we clearly know that these products are causing acute health effects. That it just stands to logic that if the virus enters a lung that's whole in terms of its functioning and structure, it is potentially less likely to cause more severe disease. Whereas if the virus enters a lung that's damaged, that the structure has been broken, that is more permeable, that the virus is going to be able to get access perhaps in larger numbers or a larger viral load. It's just absolutely logical. I don't need, that's the data will tell. But logic stands to say that this is what's most likely to happen.
Is there a gap in good information on COVID and vaping?
I think, Cindy, there's a good information gap because I think it's certainly worrisome to a lot of people. I have not seen any systematic studies or any studies that are well conducted to address this issue. So I think more data will have to be collected and understood. The problem is that sometimes this information is living in two different universes. We see patients coming into the hospital or the clinics and they have severe COVID. And most of the times, unless they're participating on a very specific study, we're not asking questions about vaping. Right? So we're missing the opportunity to collect that information. So I think there's a huge gap from the research and public health information side. So we're not feeding that into families and parents because we just don't know. Aside from somebody like me saying, this is potentially a big thing and a big risk. But concrete data that I know of has not surfaced yet, but it will. I think it's a matter of time before people have court studies where people have been vaping and then some of them get sick and then people can look at the information and see what happened.
What would you suggest for parents, especially right now?
I'm a parent of two adolescents, two boys. So of course, especially me being a pulmonologist, vaping is a very, very common topic. I think I've asked my 15-year-old like 1,000 times if he's vaping. But, I think, first of all, I think it's important to have an open discussion about the dangers and the terrible addiction. One of the things, Cindy, that we've seen, and I've seen personally some of the studies that we're doing, is, really sad to hear about teenagers talking about their friends who are looking at them going through withdrawal, through nicotine withdrawal. The nicotine content in these products is very high. And so that causes problems with the adolescent brain that's being developed, as well as the lung, like we talked about. So, I think we need to talk to kids very openly about these dangers. And, if as a parent, if your son or daughter is vaping, it's also not the end of the world. I think creating a war between parents and kids is not helpful. I think my approach would be to be, helpful, proactive, supportive. That's the way to approach it. Most people know that if you get too hard or antagonize a teenager, you're going to get sometimes the opposite response. So I think it's just having an open discussion and being supportive and trying to get help. And there's actually many states, Colorado being one of them, have actually developed a fair number of resources to help kids, specifically for vaping, not tobacco related. And some of them have had good success. Some of the programs that have been developed have been actually through adolescent peers that don't vape, so that they're more closer to what it's a lot more relevant to them. But clearly, I think just suffice to say that it's important to talk about these issues. If we don't talk about vaping, and kids do it, then I think it's a lot less likely that they will be able to stop or even prevent from using it in the first place.